Welcome to the press briefing. On stage, we have two doctors, Dr. Albert Au, Principal Medical and Health Officer from Communicable Disease Branch of CHP, and also Dr. Lau Kai-hin, Chief Manager from Hospital Authority. Dr. Au, please. Fellow citizens, friends from the media, good afternoon. I'd like to report to you the number of cases reported yesterday, dated the 18th of May. Yesterday, there were 116 cases tested positive by PCR, 22 reported by HA, 28 by our public laboratory service, and the remaining 22 are by our private laboratories. We have got 175 new positive cases confirmed by RAT. Yesterday, we had a total of 291 positive cases. In the fifth wave so far, Hong Kong has got a total number of 1.19,007,557 positive cases. 749,293 tested positive by PCR and 448,764 by RAT. For newly reported cases yesterday, 38 were imported, and the remaining 253 local cases. Among the 38 imported cases, 22 were detected at our sample take collection point at the airport. 14 under mandatory quarantine in quarantine hotel. 2 tested positive on day 2, 3 on day 3, 2 on day 4, and 7 on day 5. For these imported cases, 14 were from the US, 6 from Taiwan, 4 from Thailand, 3 from Canada, and 2 from the UK, and also some from Mexico, Israel, Norway, Switzerland, United Emirates, Malaysia, and also Indonesia, 1 each. For imported cases yesterday, 1 was detected on day 12 at a community testing center. We suspect that it is a positive case involving a 23-year-old female addict and with 3 jabs. She arrived from from Thailand on the 4th of May. So she was still positive on the 12th of May, and then on the 16th of May, a sample taken at a community testing center was unconfirmed. It was re-examined at a public health laboratory, and then the CT value was high, and then on the 18th of May, another sample was negative. Another person had a positive case on day 11, a 21-year-old female asymptomatic. On the 8th of May, she arrived from the UK. Last December in the UK, she was confirmed. She was in a quarantine hotel until the 15th of May. And then on the 13th of May, when she tried to enter the mainland at Shenzhen Bay, the sample taken was positive with a very high CT value at 34. And then yesterday and also on the 18th of May, both samples were negative. So we believe it was a positive case. As for genome analysis, the public health laboratory did genome analysis on 91 samples. No L452R was found. 82 were tested negative to L452R. 9 samples did not have enough viral load. As for full genome analysis, yesterday there was another BA.4 case involving a 27-year-old female with 3 jabs of vaccines. On the 15th of May, she arrived at Hong Kong from South Africa through Dubai and Singapore. She was sent to a quarantine hotel upon arrival, and she displayed mild symptoms starting from the 15th of May. So far, we have got 9 BA.4 mutant samples, and most of them were found at the airport. 5 from the UK, 2 from South Africa, 1 from the US, and 1 from Canada. According to WHO, mutant BA.4 is now found in 24 countries, accounting for about 0.5% of the cases. In South Africa, as much as 9% of the cases are BA.4 cases. Now, in our genome analysis done by the Public Health Laboratory yesterday, we found 12 BA.2.12.1 cases involving 5 male and 6 females. They arrived in between the 9th and the 15th of May. 10 samples taken at the airport were positive, 1 at a quarantine hotel. They were aged between 19 and 67. They came from, 5 from the US, 3 from the UK, 2 from Canada, and 1 from Qatar. So far, Hong Kong has got 35 BA.2.12.1 cases, 27 detected at samples taken at the airport, 8 are under quarantine. According to WHA, BA.2.12.1 accounts for about 10% of the BA.2 cases. In some cases, like the US, close to 50% of the cases involve this kind of variant. We do not have newly reported cases from care homes yesterday. Yesterday, the media asked about second infection. It was reported on the 16th of May involving an elderly person living in a care home. On the 14th of May, under a testing SWD, he tested positive. The CT value was 8.5. In February, he tested positive by RAT because the CT value is lower than 30 and is been over 2 months since the last infection. So we suspect that it may be a second time infection or a positive case. So he sent her to Northland Thailand ICC, and then samples taken again on the 17th and 18th of May was negative. So we classify it as a positive case instead of a second infection himself. And we have already canceled the isolation order involving this patient and also his close contacts. For schools, 16 schools reported 17 cases to us this morning involving 15 students and 2 teaching staff members. 15 positive by RAT, 2 by PCR. Sampling date, 1 on the 17th of May and 5 on the 18th of May and 11 on the 19th of May, i.e. this morning. 4 KGs and CCCs, 3 students and 1 teaching staff involve 8 primary schools involving 8 students and 1 teaching staff. In 1 primary school, 2 students tested positive. They are siblings, and they've also got positive members in the family. And then 4 secondary schools involving 4 students, and these cases are not epidemiologically linked, so there is no cluster or outbreak. For death, we have 1 new case of death yesterday. So far, we have got in the 5th wave 9,153 death cases. Now, for analysis of these death cases, they are very much like what is always been. We've got a new cluster this morning involving an eatery, Tam Zai Sam Go Mi Xian, at 336 to 338 of Queen's Road Central. Is at a development 338 apartment. Yesterday at around 3:30 p.m. to 6 p.m. for those who have patronized this eatery, well, they arrived at 4:28 and left at 5:03. They have all 3 male, 4 female, all vaccinated. They had mild symptoms and displayed on the 15th, and then they tested positive in between the 16th and the 18th of May. These 5 cases, they are not very familiar, or they're not acquainted. They sat on different tables, and other patrons were okay. 4 of them had taken lessons at benchmark. They were not acquainted, and the place was 322-35 Xavier Road Central, and is the Western Telecom Building, 3rd floor. So they took lessons from 11 a.m. to 2 p.m. and there are 40 in the same group. Because this is a cluster, we can't say whether there was some transmission during class or at this eatery. So to play safe, both are subject to mandatory testing. Tamjai, for those who have been to Tamjai, between 4:30 and 6 p.m. on the 13th, and to Wangxi on the 16th. Now, for the cluster involving Imperial Kitchen, there was an outbreak. On the 9th of May, we have 3 additional cases. So in between the 17th and 18th of May, they tested positive by PCR. They're all asymptomatic. So far, there are 29 cases in this cluster. Some of them are asymptomatic. For those who have symptoms, the date of onset is between the 11th to the 17th of May. 17 of them are now negative already. One is a recovered patient, so no quarantine is required. And for 2, they haven't been subject to mandatory isolation or testing. We're going to EC1.
For Sky Cuisine, well, we have found 3 new cases. A lot of patrons or customers, they were found out on the 17th of May through the compulsory testing, and they were tested positive. And 2 actually developed symptoms on the 9th of May, and 1 was asymptomatic. All of them have already completed laboratory tests. A total of 73 cases were involved. 62 were patrons and 11 were staff members, and they developed symptoms between the 8th and the 14th of May. There were 2 other clusters in Tongchong, the Tamchai, Yunnan, Misian on the 11th of May p.m. and also for the Sunmong Club, there's no new cases. Okay, from Dr. Lau. Yes, good afternoon. We have 601 staying in public hospitals, and also the North Lantau Infection Control Center, and also the AWE, and 69 are newly confirmed cases. And for those who have to go to isolation wards, 107 are now in public hospitals isolation wards, and 21 are now in secondary isolation wards, and then 47 patients are now in North Lantau Hong Kong Infection Control Center. A total of 19 patients are new cases. Yesterday, for the newly reported cases, 1 was in critical condition and 3 patients were serious. Right now, for those who are still hospitalized, 11 are in critical condition and 15 are serious, and 4 in critical condition are now staying in ICU. For the and there's 1 death case, and this was a 91-year-old female. So she passed away yesterday, and she's from a care home, and there's no vaccination record. Well, in the past 24 hours, 105 patients are recovered, including 74 members were discharged from hospital. Since the start of the 5th wave, 49,611 patients recovered. Out of those, 49,222 were already discharged. And starting from early 2022, a total of 61,991 recovered, and 61,602 have been discharged. And also, 1 patient was screened while he was in hospital, and 1 patient in the same ward was classified as close contact for the HA. So far, we have 22,979 staff members who were infected, and 22,851 already returned to their work. And there's 1 case involving the A&E departments arrangements because of the situation and also because of the need in our services, Tin Shui Wai Hospital and also the Kiwi Hospital and also the North Lantau Hospital, starting from tomorrow, that is the 20th of May, they'll be resuming normal services. As you might recall, at the peak of the epidemic, in order to cope with the situation, Tin Shui Wai Hospital, QEH and also NLH, the special arrangements were put in place, and they would only admit patients in acute conditions. Starting from tomorrow, these three hospitals will be resuming their normal services. And we are very grateful to the public for their understanding that the three hospitals had to put in place special arrangements. And we are also grateful to the hospital staff and also the fire services department and other departments for working with us. Thank you. Now questions and answers. So please raise your hands and also please identify yourself and the agency that you represent before you ask questions. Yes, I'm from RTHK. I'd like to know about the new case involving Tam Chai Mi Sian. So which location are you talking about? Are you talking about the shop location or the location near the school? Which location has a higher risk? And also you talk about the classes. Well, for how long would they be taking the class? And also have they taken off their masks in class? And also 2 people have yet to undergo the test, and you'd be issuing the compulsory testing order. So have you found out the reasons? And also for the social distancing measures, they're going to be relaxed further starting from today. So have you done any estimate as to whether or not there would be a risk of rebound, and also to what extent would it rebound, and also would it rebound? And also would there be further clusters involving restaurants and also for the Shan King Terrace, there have been it has been the 6th time where they would be undergoing compulsory testing. So have you? That is the West Terrace. So what are the reasons? Well, for the new cluster, well, in this cluster, well, if they're related to the eateries, there were 5 cases, and they did not know one another. So probably they were there within the same hour or two, and they were in the same restaurant. And we also tried to find out where they were seated, but then apparently they were seated at different tables. And out of those 5 customers, out of the 5 customers involved, well, as I said, they attended the same class together, and they did not know one another per se, but then they just knew that they were attending the same course. As to Tam Zai Sam Go, well, other than the 4 classmates, there was another case, and again, that customer did not know these 4 customers. And also within the eatery, they took off their mask, and also they would be off mask for a while. So the likelihood is that there was a transmission of the disease within the eatery. But then as 4 of them were attending the same class, and on 5 days, they were attending class from 11 a.m. to 11 p.m. And some students have also told us that while they were attending class, there were chances that they might take off their mask from time to time. So it might also be possible that they might have got infected while they were attending the classes. And also within that class, there was another case involving a 35-year-old male. And on the 16th of May, he developed symptoms, and the RAT test was also positive on the same day. And he did not go to Tam Chai, but then he was also attending class at this school. And therefore, we would conduct further investigations. We would take environmental samples from the restaurant, and we try to see if we would be finding some new positive cases. And we would also be asking the restaurant to provide us with the vaccination pass information, so as to contact the customers and ask, so that we can also ask them to undergo further tests. We have also contacted Benchmark School. So from the 11th to the 15th of May, we'd like to get the information of the students and the staff members, so that they would also undergo the PCR test. And then we would be monitoring the situation closely to see to what extent there's an outbreak and whether or not it was taking place at the school or at Tam Chai. And there were also 2 cases involving Imperial Kitchen, and they also patronized Imperial Kitchen on the 9th of May. We found that they had not undergone the PCR test yet, as the orders has expired. and therefore we will be issuing the compulsory testing order. We would ask them to undergo the test as soon as possible, or else they would be breaking the law. And the third question is about social distancing measures. Yes, starting from today, we will be relaxing the social distancing measures, and further premises would be open again. And of course, that would also entail some risk involving people taking off their masks. And therefore, members of the public would also have to be mindful about that, because if they were to take off their masks in these premises, they would also have to pay attention to their personal hygiene and so on. Given the current state of the epidemic, we believe that the situation is still stable. Even though we are not saying that it's very low, still we are having about 200, 300 cases a day. And during the past fortnight or so, or at least during the past 2 weeks, we haven't seen an obvious drop in the number of cases. Previously there was a steady decline, but then during the past 2 weeks or so, it remained more or less flat, probably because of the relaxing of the social distancing measures. As a result of that, there might have been more spread. But then if you look at the figures recently, they are relatively stable. And during the past 7 days, the average daily number of cases was 289, and then the previous week saw 278. And then starting from the 1st of May, we saw the drop to below 300. And then between 1st of May and now, the average daily number was 288. So apparently there might have been some daily fluctuation, and yet the situation has been stable.
The last question was West Terrace. Sewage surveillance program found that the viral load was very rather high involving West Terrace. So we did a restriction testing operation. 16 cases were identified, including those found earlier at West Terrace. There are a total of 23 cases. Most of the cases have been arranged to a community isolation center. Now, for some of the residents, for family reasons, they're allowed to undergo home isolation because we still have positive samples from our sewage surveillance program. So another restriction testing operation was done last night. One case was found involving a family member of a household with previous cases, also under home quarantine. So 24 cases are found in this building so far. Perhaps the positive samples from the sewage were from recovered or yet to recover patients. Their waste may carry some virus. Speaker was off mic. That's the information we have so far. The lady at the back. I'm from Orange News. Now, an expert said that if we do not have a steady increase in the percentage of serious critical cases, so our road to normalcy should not be affected. Does that mean that there is no cause for concern? As for ventilation in eateries, an expert said that the ventilation in Sky Cuisine was not desirable. Can you tell the reason for that? And will the government step up patrol of these eateries? And as for Imperial Kitchen, Dr. Ao said that it was found that someone gave false information that the Department of Health follow-up action would be taken. Is there any progress in this regard? Thank you. On ventilation in eateries, now we have approached the EMSD staff to do an inspection of Sky Cuisine, and it's found that the exchange of fresh air was not sufficient. Perhaps this has something to do with the some problem with the ventilation system of the restaurant. On our day of inspection, we found that the fresh air exchange was not adequate. And then there is the purifiers. Perhaps on that evening, not all air purifiers were fully turned on. And then there was some problem with the exhaust system. at the washroom. So perhaps for some reasons, air ventilation was not satisfactory on that evening. So when there was a super spreader there, it led to a rather large-scale cluster or outbreak. We have approached staff of Department of Health and EMSD to require the restaurant to carry out improvement works, and another inspection will be done afterwards. Now, all restaurants will have to follow the infection control measures under the licensing conditions by FEHD, including hygienic conditions and also ventilation. FEHD has issued guidelines, and if they follow the guidelines, the risks can be minimized. Of course, government departments from time to time inspect these eateries. The government has also set up a working group to review the latest guidelines for restaurants and eateries to see whether they have to be updated or reviewed. On Imperial Kitchen, we found that there might be cases who provided false information or concealed information to us. Now we will follow up, and if need be, we can pass it on to law enforcement agencies for follow-up because it involves involvement and enforcement and maybe prosecution. It's not convenient for me to further comment. I'm from cable TV. Now I'd like to ask about Tam Chai in Songwan. So will environmental swabs be taken? We have seen clusters in Tam Chai. What is your view of their ventilation system? I'd like to know how the cases were seated. And for the lecture, we're told that some of them removed their masks. So what was the class about? Why were they required to remove their mask? I'd like to HA some follow-up action of Dr. Zhang Weiman, who's been prosecuted for theft. Regarding Tam Chai in Shanghai, we're still investigating this cluster, which was only identified this morning. So we are now investigating the cases and to track their whereabouts. And it's found the 5 cases have been to Tam Chai, Samgo, and then there were 5 cases and 4 of them have been to Benchmark to take lessons. So we will go to the eatery to understand the situation, and we will take environmental swabs and check their environmental hygiene and ventilation system. I have no further information to add. And as for the classes at Benchmark, so in between the 11th and 15th of May, they took part in a course. Some of them told us that some of them might have removed their masks during class. Now, from hygiene point of view, now, if you're indoors, if you are in a class, it's better for you to keep your masks on and to observe social distancing measures. We will update you on results of further investigation. Now, the case you mentioned is now sub judice, and HA has nothing more to add. I'm from HAET. Regarding the 2 imported cases tested positive after quarantine, I'd like to know whether they have any previous record of infection. You said that environmental swabs will be taken from Tam Chai. Will you ask the eatery to suspend operation pending results and after thorough cleansing? And I'd like to know whether there were people eating together at the same table as those confirmed cases. If so, will they be subject to mandatory testing? And as for the class, now, if some of them had removed their masks, will fellow students be required to be tested? And then experts said that if the situation improves, then there's the possibility of abolishing the flight suspension mechanism. What is your view?
第一個
Well, on the imported cases, well, the patient was found positive on the 12th day, and at the community testing center, the result was uncertain, and therefore a further test was taken. So that's the 12th day, and then on the 18th, she took the test again, and it's negative. And indeed, the CT value was very low in the first place, and while she stayed in the hotel, there was no further cases found, and therefore we suspect that it's a repositive case. And she herself did not have any record of previous infection, and therefore would be doing full genome sequencing. But then given the virus load is so low, and according to our experience, we might not be able to complete the test. Another case was that in December, while she was in the UK, she was confirmed infected, and then on the 8th of May, she came back to Hong Kong from the UK, and she was tested negative during her stay in the quarantine hotel. And then on day 10, when she tried to go to the mainland, and when she crossed the border, she gave a sample, and the CT value was 34. It's quite high. And on the 17th and on the 18th of May, she underwent a PCR test, and both were negative. So we believe that she was infected in December last year, and therefore this is a transient repositive case. And then afterwards, she was tested negative, and therefore we would classify that as a repositive case. Another question is about Temchai investigation. We have already advised the eatery to undergo a thorough and complete disinfection, because there were a number of cases who had been there on that same day, and also because of that, the location would also be subject to this compulsory testing notice. And it's not just a Temchai, but a benchmark training would also be subject to the same order. And for those people who have been there at the two locations, they would also have to undergo a PCR test tomorrow. And then we would be able to find out the scale of the infection and how many people have been affected. Because at these two locations, in the relevant time slots, there were 5 cases already, and therefore it's a risky premises. They are both risky locations, and therefore for those who had been there, it's better for them to undergo the test in order to find out whether or not they had been infected. And for those who have to undergo quarantine, most of them would be close contacts, and the definition is either they are family member, or they had been face-to-face with a patient, and they had their masks removed. And if they were in the same eatery or in the same restaurant, if they were there during the same time slot, and if they were not at the same table, they would not be classified as close contacts. So we would try to ask them to undergo a test in order to find out if they had been infected. The last question is about removing your face mask. Right now, the epidemic situation is that it's still at a relatively high level, even though it's quite stable, just between 200 and 300 cases. So members of the public will still have to be vigilant about the personal hygiene. They will have to wear their face mask, whether or not they are indoor or outdoor. They will have to wear a fit face mask. And if they have symptoms, they would also have to undergo a test as soon as possible. If you look at the trend of the epidemic, it's hard to tell what is going to happen in the future. Well, by summer holidays, whether or not the epidemic situation in Hong Kong will be better or worse, we are not sure. But then, of course, we will have to look at a number of factors. The vaccination rate, for example, by July, for those who have had 3 jabs, we will have to look at how many people have already had 3 jabs so that they would have full protection, and whether or not there would be a new mutant strain coming into Hong Kong, causing another wave of outbreak. We would also have to monitor the situation as to the number of cases every day, and whether or not there have been serious cases and death cases and so on, before we decide on the future anti-epidemic measures. Next, please. Well, for the students, about 39 students were in the same class, but then we would have to find out more, because we're still obtaining the information. Next, that lady. I'm from Mingpao Daily. I'd like to know more about benchmark training. So I'd like to clarify the situation. Yes, they might have taken off their mask, but then have they consumed any food and what kind of training were they undergoing? And also for Tam Chai and benchmark, a total of 5 cases have been found. So which was the source of infection? So is it the person who developed symptom on the 15th of May? Was he or she a benchmark student, or was he just a customer of Tam Chai? And also for Imperial Kitchen. So for the 3 visitors, were they visitors, and have you done the full genome sequencing and so on? So would that be classified as community infection? And also for the Tam Chai test, yesterday was the expiry date of the compulsory testing order. So have you not been able to contact some of them? And have you also done the full genome sequencing, and what's the outcome? Well, for the new cluster that we have identified today, we are still doing investigation. For those who had been to Tam Chai, the 5 cases, well, the earliest one developed symptom on the 15th of May. So the date of development of symptoms range from the 15th to the 18th of May, and they patronized Tam Chai on the 13th of May. As for benchmark training, there were also 5 cases, and 4 had been to Tam Chai, and 1 did not go to Tam Chai. And he developed symptom on the 16th of May. And one of those who went to Tam Chai was not a classmate. And we are trying to find out more about the relationship between these cases. It's hard to tell whether or not this outbreak or this cluster first took place at which of those 2 locations. It could be that someone was infected at Tam Chai, and then he started to infect others at Benchmark. We would have to do epidemiological investigation to find out where they had been, and also the testing results. With regard to Imperial Kitchen, the genome sequencing is something that we are doing. We will do the full genome sequencing to find out whether or not this cluster has anything to do with other clusters, and whether or not the genome sequencing is identical. As to the Tongchong cluster, the compulsory testing expired yesterday. In other words, everybody would have to undergo the test either yesterday or before. And some of the reports have yet to be out, and so we still have to wait. For Imperial Kitchen is a visitor, so he or she was there on the 9th of May. Next, that gentleman. I'm from AM 730. First, on the Shangwan Sam call. So for the 4 classmates or students, they were not very close friends. So were they seated at the same table or what? So you said that, so are we talking about 5 separate tables, or was it that some of them were seated at the same table? And how many people were there during the same time slot in the restaurant? And also, you talk about going there and also developing symptoms. Was it that the 5 patients were not customers, and there might have been other customers who had been infected, but still they have not been identified? And also, where there are more than 1 person at the same table being infected, so would you be making announcement? Would you be stepping up tracking? And also for people having their meal at the same table, but they do not know one another, would that also be one of the reasons of these cross infection? And also, you said that you did not find out the reasons why some of the people got infected at Imperial Kitchen. Have you found out more now? So can you tell us more? Thank you for your questions. Concerning the Tam Chai Sam Go Mi Xian, the 5 cases, according to our understanding, they were seated at 5 separate tables, because according to what they told us, they went there alone, and there was no other customer at the same table. So apparently they didn't know one another, and they were just going there on their own. So for the time being, there were some customers who have either not been tested yet or who have yet to develop symptoms. But then the thing is, if they did not know one another, and then if they patronize the restaurant at the same time, then they might still get infected. And therefore, through compulsory testing, we are trying to identify other cases. As to how many people were there on the same day, we are still trying to find out, because we can get hold of the information through the vaccination pass records. Because for people going to restaurants, overwhelming majority would have to scan their vaccination pass first. That would also help us trace and track those people and contact them, and then ask them to undergo PCR tests. Generally speaking, for people seated at the same table, if they know one another and if they go there together, then they would become close contacts, because they were seated at the same table, and they would also remove the mask, and they would also chat, and they would also be eating together. And sometimes when they go to the restaurants, they would also have close contacts. And therefore, generally speaking, for close contacts at the same table eating together, and if they were with the patient during the same time slot, they would be asked to undergo quarantine. And if their home environment is suitable, then they can also undergo home quarantine. For those who are seated at different tables, they would not be classified as close contacts normally. And if there's already partitioning, and if they did not know one another, then basically it's hard to find out whether or not they were together. But then, generally speaking, if they did not know one another, we would not classify them as close contacts. For Imperial Kitchen, I already gave an account yesterday. Our investigation is completing, and the announcement has been made. We expect that there were some 49 people were at that location, and there was an event. There was a gathering, and for the duration that they stayed in that location, it varied. And also, some also removed their masks during their stay, and there might have been one super spreader who might have been there, and that constituted the spread. And we are now following up on that visitor and also the testing result, and 2 others have yet to undergo the test. We'll be doing follow-up action. This is the end of the press briefing. Thank you very much.
For course,